Dr. Chatterley, we talked about missing teeth and how missing teeth can actually really create havoc, not only because you have one or two missing teeth, other ones can start falling out eventually, even though it doesn't come fast, but they keep moving like a bad fence. But also you mentioned headaches, neck pain, all kinds of stuff could happen because the whole mouth gets out of alignment. Now, what are some of the methods of replacing a missing tooth? Have there been advances made in the last 10, 20 years, whatever, 5 years, in terms of replacing a missing tooth? I heard, not so sure it's true, that George Washington was having a wooden tooth in his mouth. Have there been improvements since then?
Yeah, you heard correctly. George Washington had a lower denture that was carved out of wood and with some teeth on it. But there have definitely been some improvements in the last 5, 10 years. Implant dentistry has come a long ways quickly, and it's a lot of research and a lot of innovation. Implants are now very predictable, that they weren't nearly as predictable 15 years ago. And a person can have implants placed, and it's more complex dentistry because you're replacing the root system as well as restoring the tooth, but it's a definite additive to the options for patients to get as close to real nature as possible.
What other methods do we have? So we have implant, and we'll eventually go and talk about how an implant actually, is made and why it maybe lasts is better. But what else is available?
One of the things that's been developed over the last 12, 15 years and has been refined and is in a more exact science is treating periodontal disease with a laser, a specific laser.
I'm talking about replacing a tooth. I'm talking about replacing a tooth.
Replacing
yeah,
teeth.
I'm talking about replacing a tooth. Let's stick with that topic, Dr. Chatterley.
Okay, well, the implants have opened the option to be able to place each tooth singly or several teeth, or give rigidity and much better function to removable appliances. Somebody that's perhaps been in dentures for years, and the dentures are, because of the ridges have gradually receded and melted away, and they're having great difficulty chewing with dentures. They can have implants placed and have prostheses made that are more rigidly or very rigidly held, depending on the case, with implants, and improve their function and ability tremendously. I mean, tenfold from what they had been doing with the dentures. So individual teeth, though, the implants and have been the big boon to be able to restore teeth individually without necessarily the option has always been available and is still used to do a bridge where the teeth on either side are prepared for a crown. But now with better implants, there's more availability to replace teeth even in a crowded area with a specific designed small implant.
So when you do a bridge, meaning you have a tooth here and you have a tooth here, and in the middle there's nothing, and when you say prepared and teeth next to it, that means what you mean is grinding them down so that you can put a cap or a bridge or a crown over it, and then in the middle you hang a fake tooth in it, right? That's what you mean by prepare, right?
Right, exactly, to reduce the tooth on either side so that they get crowned, and then the three of them are made together. So it's a support or abutment on each side, and the one that's suspended is called a ponic. So that's why they call it a bridge, because it has a support on each side and has a span.
And what's the disadvantage of that? I mean, obviously that function, putting on a bridge, has been around, in our lifetime forever, I think. And I'm sure it got better, but because bridges got better, the ceramics got better and all that stuff. But in terms, compared to fast, we don't have lots of time here, Dr. Chatterley, but compared to an implant, give me fast a 1 to 3 advantage of a bridge or disadvantage, and a 1 to 3 advantage or disadvantage of an implant.
The advantage of an implant is that it involves only the tooth that's missing that area. It doesn't involve the teeth on either side. You get function restored. It makes for a better periodontal condition because you're able to floss and brush and maintain each tooth individually. Those are the advantage of an implant over a bridge. Now, a bridge has worked well and sometimes is the option, but it is more tedious. The person has to thread their floss under it every day. Consequently, there's generally less compliance, and then it can be there can be recurrent problems because of periodontal disease. So, for the sake of keeping teeth individual and also then the cleansability and maintenance, an implant is better choice where possible than a bridge.
Well, it would for me in this case, from what you explained, because at night when my wife and me go into the bathroom the same time, I finish showering, shaving, washing, brushing, and she's still on the first 2 teeth, I think, So imagine if I have to go and take a thread below, I would probably forget it a few times, and then what you say is I would have a high chance of developing gum disease, which you talked in other videos how devastating that is. Let me ask you, what's the durability? You put on a bridge, on an average, I know there's no really, you can't put a total, 1 year, 2 year, 10 years type of thing on it, but on an average, a bridge versus an implant, how long does one last versus the other one in a good rule of thumb measurement?
A bridge, insurance companies have decided that they'll pay to redo a crown or a bridge after 5 years. I see bridges go a lot longer, 10 years, 15 years. An implant, they go, 10, 15, 20, 30 years. There's implants. I had a patient in the other day that had one of the very early implants. They were called blade implants. It had been in there 40 years, and it was still functioning for him. I can't promise that on all implants, but it shows that even the earlier, less sophisticated implants have that capability of durability and longevity. The advantage of the implant is again, it involves one tooth in one area. When a bridge is a very good option, has been and will be, but it involves more teeth, so there's more potential for redecay along the edge or margin of one of the other teeth, and then the whole bridge is jeopardized if one gets redecayed around it.
So an implant, you saw one lasting 40 years, and I'm sure at that time they didn't even use the titanium, metal stick which they stick up. They used a different one, which the titanium one works lots better, and the other one works less. So in the end, basically, if you have to replace your bridge, let's say in 7, 8, 10 years versus an implant lasting 2, 3 times, 4 times longer, actually a bridge is going to cost you much more money on the long run for sure, even though it's probably not even that much more expensive at the beginning of an implant, but maybe a little bit. But in the long run, I guess it's a huge difference, never mind having to go to the dentist for, a rather tedious procedure such as a new bridge, right?
That happens to work out to be the case quite often, is that the bridge will need to be replaced, had it been an implant and a crown, very often it's less likely to have to be replaced. And when it is replaced, it's still that one area instead of involving more teeth. But there's situations where bridges are most indicated, but now with the improved implants, we always try to consider those first because of the advantages.
Right. I can see so, and it's almost like why. In everything else, from computer to everything else, cell phones, we change them every 5 months now, just so that we have the newest and best. So why would we not use that in medicine? I mean, who wants to have a medicine, for instance, a drug which was 20 years ago, and there are better ones out there. Obviously, you try to get the better one if it applies. And then again, sometimes maybe the old method, for some reason, is just as good and good. Well, anyway, appreciate your information again. Very informative. I'm sure that people watching this video will know more about implants and bridges than they did before. Thank you very much.